Hello everyone, Assalamu alaikum. Welcome to our documentary on healthcare system of Bangladesh during COVID-19. Throughout the world, governments of various countries are taking extraordinary measures to deal with the crisis created by the COVID-19 pandemic. Cross-country evidence shows that governments that adopted the most extreme measures most promptly were the ones most successful in reducing the number of new cases and deaths. The scale and the spread of the pandemic have proved that there is no way to contain the spread of the coronavirus without strict social distancing. The COVID-19 wave has showed how unprepared the world is in terms of managing its health and economic implications. Worse, no country has enough medical preparation and support for tackling COVID-19. The number of affected countries is increasing every day and the number of cases is multiplying around the world. Bangladesh is no better than other affected countries in preventing the coronavirus pandemic. The existing healthcare infrastructure and the available medical equipment are not adequate even in ordinary situations, let alone in facing the coronavirus. Medical facilities for the common citizen are extremely limited. As of 2018, there was one registered physician for every 1,581 individuals in the country. The Bangladesh Health Facility Survey 2017 also shows that among the healthcare facilities in Bangladesh, 28% had a specialist, 59.1% had general medical officer, and 79.7% had nurses as of 2017. The level of healthcare awareness among the general population was also found to be very low in Bangladesh. For example, the WHO recommends to wear a mask and wash hands frequently and thoroughly with soap and water more often for 20 seconds to kill the viruses which may be on people's hand. Public health awareness messages must be communicated more clearly and frequently. Wide dissemination of information on the nature of the disease and its health impacts has to be ensured. There has been initial neglect from the relevant policymakers in taking this seriously and taking immediate actions. Unfortunately, many policymakers seem to be in a state of denial at the initial phase. However, we have now observed far more seriousness on the part of the government. Drastic steps have been taken for the movement of people and moving towards a wider lockdown around the country. The current situation demands more allocation for addressing the pandemic immediately. Resource allocation should be increased in a focused and targeted way. New financial channels from foreign sources to support health-related action should be mobilized. This should include a flexible system for medical supplies. The government's move to extend tax rebate on imports of all essential medical supplies is commendable. Given the limited number of hospitals, necessary makeshift healthcare facilities should be arranged at district and upazila levels. Of course, this should be adequately equipped for treatment and health support. All medical colleges, nursing institutions, and other healthcare establishments and voluntary organizations should be mobilized to extend their support towards addressing the COVID-19 emergency. However, they should be adequately provided with personal protective equipment (PPE) for their own safety. It may be emphasized here that the healthcare professionals are equally vulnerable to COVID-19. Italy is a case in point, where the highest number of doctors died compared to the other countries due to the shortage of essential medical supplies and equipment. This also happened around the world to the health professional due to the lackings of this equipment in time. Disposal of medical waste is a fast-growing problem in Bangladesh. More than 3,000 tons of COVID-19 related waste was produced last month in Dhaka alone, as walking down the street usually find COVID masks, gloves and other items that may pose health risks to the sanitation workers who have not enough protection. Global cooperation is essential for public health around the world. In poor countries with high population density and developing countries like Bangladesh, A pandemic can have unprecedented impacts on the people's health and livelihood. It can worsen the property situation and lower the human development situation. The COVID-19 experience shows that no country can fight such a crisis alone. Therefore, all countries should come forward to collaborate to overcome this deadly disease. Thank you everyone for hearing this with patience. Assalamu alaikum.